So when it was apparent that the pandemic indeed was going to arrive and had arrived in Australia, we need to think through carefully what the impact that might be on different parts of our service.
So look, Kirketon Road's got a particular emphasis on working with people living on the margins of society, people with a history of drug use, sex workers, at-risk young people, and people affected by homelessness. Many people from those communities have multiple and complex health needs.
Kirketon Road Centre provides hepatitis C treatment, HIV and sexual health care, drug treatment for people who use opioids, general medical care, harm reduction such as naloxone supply, clean needles and syringes. We have an Aboriginal health programme, a homeless health programme, and importantly we include social and counselling services.
The people that work with KRC are human. These guys really do care, and these guys are amazing, the work they do.
KRC has provided outreach services for the 30 years of operation, and so that's obviously morphed and changed over time and needed to adapt to changing circumstances. And so COVID was another adaptation of that.
One of the key things for us to consider was what is our overarching model of care and how do we retain that and the value that provides for the individual clients.
We've had to change the way in our staff work, so we now have multidisciplinary teams on outreach. We've got doctors, we've got nurses, we've got counsellors, we've got NSP workers.
So we're going to Northcott, which is a social housing estate where a lot of disadvantaged people live. The idea of setting up the clinic there is to give people access to healthcare and COVID tests that might not normally have that. And then after that, we're going to head to Woolloomooloo and then Martin Place to finish it off tonight.
So when we arrive at the site, we set up a mobile testing clinic using tents and movable desks, and it gets up within about 10 minutes. The capacity to provide other services there often does depend on the demand at that time for coronavirus testing.
So we're at the hub at Lexington Place in Maroubra, and we're just setting up for our second stop of the day for COVID testing, as well as doing some flu vaccines and just some opportunistic sort of primary health care. We understand that our clients aren't always comfortable going to your regular healthcare clinics. They might feel uncomfortable there. They may not feel like they've had a positive experience in the past. So KRC has always been more than happy to go to the clients, go to where they are in their space and actually give them the care that they need.
It's a very unusual concept to wear a mask and try and connect with individuals. Sometimes you're just relying on eye contact or your mannerisms, your approach, how you're sitting.
We are at Post Corner Redfern, and I took Maria with me to get a COVID done. To me personally, I think it's really it's good because all of you are reaching out into the community to get tested. We all hear about COVID, and it's good to be aware and reach out and get tested and don't spread it in community.
One of the real risks around having such a major focus on COVID assessment is that the broader suite of harm reduction services can get overlooked. So what we recognised really early on was that it was essential to maintain really effective harm reduction services.
So today we're going to go out Maroubra, South Coogee, Malabar, and we're going to go pick up Brett, who's one of the peer connectors. The peer is vouching for us, I guess, in a lot of ways, saying that, you know, we're okay and it's a safe service. And those extra things that you can add onto it, like the dried blood spot, like the DBS and like the prenoxide and the Nixide.
I want everyone to know that we don't judge. There is no judging at all. This way we can get clean equipment. We don't infect ourselves with Hep C. We don't have anything else.
So with that, we worked really closely with the Wayside Chapel. Again, they had to change their on-cycle operations to predominantly outreach.
Through the increased relationship with KRC on outreach, It kind of means that Wayside Chapel as an organisation and the outreach teams can meet people on more fronts.
So we're now doing joint outreaches 2 or 3 times a week with a KRC NSP worker and a Wayside outreach worker, ensuring access to NSP services across the inner city.
We're able to then broaden out the conversation and touch in with them about how they're doing around hepatitis risk, how they're doing around their mental health, around any drug and alcohol issues they might have, or any other social welfare needs. So it really, I feel that coronavirus, despite being on some level very disruptive, it has actually allowed us to engage with communities on a different level and build some relationships that probably we hadn't thought about building previously.
And COVID has suddenly thrown us into this place where, yes, we can use the outreach, we can use our bus, but we can add to it and create this whole other service. And that's been an incredible learning.
In times of a kind of really global pandemic, that it's really, really important that we need to look after the health of the people who are most vulnerable in community. Because to maintain public health, community health, we have to make sure that we take care of all people's health.